So, hello everyone. So today we are going to talk about progressive lenses and all about progressive lenses. What are actually progressive lenses, how they are fitted, what are the problems, troubleshooting, indications, contraindications, everything. Okay, let's start this presentation. So progressive lenses are also known as PALs, PALs, and they are advanced multifocal lenses and they provide clear vision at all distances, distance, intermediate and near. There are no visible segment lines in progressive lenses and it is widely used for correction of presbyopia. Presbyopia is an age-related loss of near focusing ability. It will happen to everyone who reaches above 40 years of age, but the starting age of presbyopia can be decided but the starting age of presbyopia can be decided on multiple factors. In some patients it can start at the age of 36 37, and in some patients it can start at the age of 42 43. So depending upon patient to patient, presbyopia can vary, but ultimately presbyopia, everybody will reach to presbyopia. Now coming to the history and evolution of progressive lenses, early attempts at multifocal lenses were, before progressive lenses were invented, people relied on single vision reading glasses, either on bifocal lenses, which was invented by Benjamin Franklin, and trifocal lenses. So they were very common before progressive lenses were invented. So these lenses all had visible lines, image jumps and cosmetic limitations. While in progressive lenses, these all things are taken care of. Now, invention of the progressive lenses, it was first commercially successfully introduced in 1959. The first ever progressive lenses was developed by Essilor and it was marketed under the name of Varilex. It was introduced the concept of continuously changing surface curvature, and there were multiple focal powers in progressive lenses, one single lenses. Obviously, in progressive lenses, it eliminated the need for visible segment lines. So as soon as the development took place and there are modern progressive lenses now in today's world incorporate free from digital surfacing, individualized design, AI based movement modeling, personalized fitting parameters. So let's discuss the basic optical principle of progressive lenses. Progressive presbyopia occurs due to loss of elasticity of crystalline lens, reduced accommodative ability and age-related changes in ciliary muscles. Symptoms include difficulty in reading the small print, eye strain and holding the reading material farther away. As we can see in the picture, that if you increase the distance of the reading material, you tend to see clearly for some point of time while achieving the presbyopia. So power distribution in progressive lenses. So power distribution in progressive lenses has three main view zone. Number one is the distance viewing zone, which is usually located at the top of the lenses. It is used for driving, walking and outdoor activities. It provides clear vision at far distances. Number two is intermediate distance. Intermediate distance is usually when the top is the distance zone, here is the near zone and in between is the intermediate zone. So intermediate zone is basically called the middle corridor as seen in the diagram. It is used for computers, dashboard and generally indoor activities or at computer distances like you're doing a laptop work or doing some computer activity. It is very critical for modern day lifestyle changes. Then comes the near zone, which is usually located at the below of the spectacles. So it is located at the bottom. It is used for reading and it is used for seeing the mobile phone, for close work, and also it contains full addition power. Now let's discuss what are the basic optical principle of progressive lenses. The progressive corridor. The corridor is a narrow vertical channel where the lens power gradually changes from distance to near. What are the factors that affect the corridor design? Number one, add power. Number two, frame size. Number three, wearer posture. And number four is visual task. Structure and design of progressive lenses. Lens surface design. Progressive lenses can be made front surface progressive, back surface progressives, dual surface progressives. As you can see in the diagram, we can see the green portion which is the front surface of the progressive, the red area which is the back surface progressives, and the light is refracting from a surface and going towards the retina by refracting from both the surface of the lenses. Astigmatism in progressive lenses. Unwanted astigmatism is an optical compromise necessary for progressive design. In progressive lenses, there is something called peripheral distortion, which occurs on the sides of the lenses. It causes the swim of the blur effect initially, and slowly and gradually the brain adapts over the time. Now let's discuss what is freeform technology. Freeform technology are digitally surfaced using the CNC machines, and basically they provide higher precision, individual customization, reduced distortion, better adaptation rates. So what are conventional progressive lenses? These are the standard designs suitable for general use, and they are less personalized. Personalized progressive lenses are used basically, they incorporate number 1 pantoscopic tilt, number 2 vertex distance, number 3 wrap angle, number 4 frame parameters. So quickly showing you with the help of diagram as well, what is pantoscopic tilt. When we tilt our head and this angle from the back surface of the lens to the anterior surface of cornea, and if we give some angle on this area, that is called the pantoscopic tilt. What is the vertex distance? Vertex distance is basically the distance from the back surface of lens to the anterior surface of the cornea. Okay, repeating this slide. Okay, so personalized progressive lenses, customized lenses basically incorporate 4 parameters. Number 1 pantoscopic tilt, number 2 vertex distance, number 3 wrap angle, and number 4 frame parameters. So these 4 things are counted in customized progressive lenses. Okay, so quickly now discuss what is the pantoscopic tilt. It is the angle which is given in the spectacles here, and if we do it little close, and the angle from the eye to the back surface of the lens, it creates an angle. This angle is called the pantoscopic angle. If it is going away from the cheeks, that is called, retroscopic angle. Towards the eye, that is pantoscopic angle. Okay, number 2 is the vertex distance. The back surface of the lens to the anterior surface of cornea, the distance is measured in millimeter, and that is called the vertex distance. What is the wrap angle? Wrap angle is the facial angle. When we wear spectacles, it creates an angle here on the sides. That is called the wrap angle. And what are the frame parameter? Which are the A, B, C, D, which is the frame width, lens height, lens diameter, which is measured from effective diameter from center of the cornea to the maximum surface of the lens into 2 plus 2. That is the, we check the diameter, and then the bridge width. So these things are all counted in while making up personalized progressive lenses. Now coming to the occupational progressive lenses. So basically these lenses are designed for office workers, computer users, limited, and they have very limited distance vision. They're usually manufactured for let's say suppose about 10 meters or 12 meters or 15 meters, not beyond that. Then there's called short corridor progressive lenses. These are used in small frames, faster power progression, and may require adaptation. Plastic CR39 lenses, lightweight, good optics, thicker lenses. Polycarbonate, impact resistance, good for children and slightly lower optical clarity. High index materials, thinner and lighter, ideal for higher prescription, more reflections, need air coatings. So if the index is higher, so definitely it needs an anti-reflecting coating to cut out the reflections. In the chart we can see the percentage of thickness from 1.57 to 1.67. As soon as we take one power, and one power is for one particular index is 15% thinner in 1.57 index, is 20% thinner in 1.59 index, 25% thinner in 1.6 index, and 30% thinner in 1.67 index. So anti-reflective coating improves the clarity, reduces the glare, it enhances the night driving. Blue light filter is used for digital device user as well, and reduces the eye strain. Photochromatic lens coatings, basically they darken in the sunlight, protect against the UV rays. Normal adaptation period is typically 1 to 2 weeks, and the brain learn to adapt to different zone in progressive lenses. So common adaptation symptoms are number 1, mild dizziness, peripheral blur, and swim effect. Usually what happens in progressive lenses, when we initially dispense the progressive lenses, people have a habit of wearing the progressive lenses and looking through the sides of the lenses like this. So when they look through the peripheral area of the lens, then they experience a swim effect, which is called the blur or swim effect, and it is usually happens in progressive lenses. So there is a way when we dispense the progressive lenses, we always have to tell the wearer to move full head rather than just the eyes. Suppose someone is calling from the peripheral areas. So we have to move our head like this rather than just looking through the eyes. So there are very easy adaptation tips in progressive lenses. A, you can wear the progressive lenses full time. Move your head, not just the eyes, as I mentioned, and avoid switching the glasses frequently. That means if you have any glasses with you which has different power and you are using a progressive lenses as well, so don't switch over between the two different glasses at one point of time. So there is no visible lines, as I showed in this glass. It is a progressive lenses and there is no visible line in it. So it's natural vision at all the distances. It is had a better cosmetic appearance. It is one pair for all the tasks and it improves the quality of the life. So advantage of progressive lenses is there is no visible lines. As we can see, there is no line in a progressive lenses. It provides the natural vision at all distances. It has a better cosmetic appearance and it's one pair for all the tasks, improves the quality of the life. So what are the limitations of progressive lenses? Number 1, peripheral distortion. Number 2, learning curve. Number 3, higher the cost, and it is not ideal for all the patients. You have to select which patients are ideal for progressive lenses. So what are the limitations of progressive lenses? Number 1, peripheral distortion. So peripheral distortion is one of the most common limitation of progressive lenses. So if the patient experiences a peripheral distortion, you should tell the patient that it contains multiple power in single lens, and to achieve the smooth power transition, unwanted astigmatism is created in the peripheral side areas. So this causes the object viewed from the side to appear blurred, stretched or distorted. So what is the effect on the wearer? Reduced clarity in side vision, swim effect while walking or moving the head, difficulty judging steps or curves initially. Why it happens? Optical compromise required to blend distance, intermediate and near powers. Strong near adds power, increases peripheral distortion. Clinical note: distortion decreases with advanced lens design. Most user adapts within 1 to 2 weeks. Learning curve: progressive lenses require a period of visual adaptation. So usually progressive lenses are adapted slowly and gradually. So unlike the single vision or bifocal lenses, progressive requires the users to look straight ahead for the distance, lower eye for intermediate, look down for near task. So common adaptation symptoms are mild dizziness, eye strain, headaches, discomfort while walking. Why adaptation is needed? Brain must learn to use different lens zones. So common adaptation symptoms are mild dizziness, eye strain, headache, discomfort while walking. And why adaptation is needed? Brain must learn to use different lens zones, changes in eye-head coordination, new visual habits are formed. So who struggles more? Those people who are the first time progressive users, elderly patients, and patients switching from the bifocals to progressive every time. So what are the limitations again? Number 3 is the higher cost. Progressive lenses are a little more expensive compared to the spectacle lenses, which are single vision or bifocal lenses. And what are the reason for the high cost? Basically, number 1 is complex lens design, advanced manufacturing technology, digital free form surfacing, customization and personalization. Number 4 is not ideal for all the patients. Progressive lenses are not suitable for everyone. Patients who may face difficulty, patients with severe binocular vision problems, poor eye coordination or strabismus, neurological or balance disorders, very high art powers, presbyopes. Occupational limitation: pilots, machine operators, surgeons, people needing wide stable vision at one distance. Physical limitation: patients with neck stiffness or limited head movement cannot easily align viewing zones. Psychological factors such as unrealistic expectations, low tolerance of blur, poor motivation to adapt. So indications of progressive lenses, these are very important. Number 1 are the presbyopic patients, individuals who are actually above 40 to 45 years of age and experiencing the near vision difficulty. And why progressives are indicated? Simultaneous vision correction for distance and near. Number 1, it's a very natural vision experience. Number 2, there is no need for multiple glasses. You can have one glasses which can correct all the 3 distances at one point of time. So patient with active lifestyle, those are professionals, frequent travelers, drivers, and progressive lenses allow seamless transition between all the distances. So patient concerned about appearances, no bifocal lines, younger looking spectacles improve the confidences. Patient with mild to moderate presbyopia, lower eye powers adapt more easily and wider viewing zones. Patient with good binocular vision, A, proper eye coordination, no significant strabismus or squint, C. Better adaptation. Patient using digital devices, continuous intermediate vision, reduced need for the head movement, and better ergonomics. What are the contraindications of progressive lenses? A. Patient with severe binocular vision disorders, example with squint, poor fusion, or suppression. And why progressive lenses are contraindicated? Progressive lenses require coordinated eye movements, may cause diplopia or discomfort. Patient with high eye powers, advanced presbyopia, narrow reading zone and increased distortion, difficult adaptation. Patients with poor neck mobility, that means if the patient neck is stiff and suffering from any kind of spondylitis or cervicals, so then the movement is limited. Then limited head movement, those patients struggle to align the head position correctly. Patients with occupational constraints like pilots, machine operators, surgeon, they may need wider single vision zone or task specific lenses. Patients with neurological conditions such as Parkinson disease, balance disorder, vestibular issues, progressive distortion may worsen the symptom. Patient with very small frames, inadequate fitting height, compromised vision zones, first time wearer with unrealistic expectations, expect instant clarity, low tolerance to blur, and poor compliance. Now, what are the clinical considerations we usually perform for dispensing of progressive lenses? Number 1, accurate refraction, precise distance and near prescription. Number 2, correct eye power, proper frame selection. There should be adequate vertical depth from center of the eye to the lower part of the lens, lower part of the frame. Stable nose bridge, accurate measurements like monocular PD should be measured very accurately, fitting height and vertex distance. 4. Proper frame adjustments, like there should be proper pantoscopic tilt, level frame alignment, secure nose pad adjustment, stable frame position. Next is patient education. Explain the lens usage, inform about the adaptation period, teach head and eye movement, encourage full time wear. Follow-up care is usually done for progressive lenses after 1 to 2 weeks and check comfort at all the distances, reassess fitting and alignment, and address complaints early. Education is very important in progressive lenses. So educating the patient improves the success rates. So usually what we explain to the patient is the adaptation process, head movement, peripheral distortion, and proper usage. Number 1, blurred distance vision. Blurred distance vision, and what could be the possible causes for blurred distance vision? What could be the possible causes for blurred distance vision? Incorrect distance prescription, wrong pupil distance, incorrect fitting height, frame slipping down the nose, excessive pantoscopic tilt. So patient can complain difficulty in seeing the road signs, blurred vision while driving, and eye strain during the distance viewing. Troubleshooting steps: recheck the distance refraction, verify monocular PD, check fitting cross alignment, adjust frame for proper position, ensure correct frame size. Number 2, blurred near vision, reading difficulty. What could be the possible causes? A. Incorrect near eye power, near zone position too low, patient not lowering the eyes properly, and insufficient adaptation time. And what can be the patient complaints? Difficulty reading the small print, holding the reading material too close or too far, and eye strain during the near work. And what will be the troubleshooting steps? Number 1, reconfirm the near ad, raise fitting height if needed, educate patient on eye movement, and encourage full time wear. Number 3, narrow reading area. And what could be the possible causes? A. High near eye power, short corridor progressive design, small frame size. And what could be the patient complaints? Frequent head movement while reading, loss of focus at page edges. Troubleshooting steps would be recommended wider corridor design. So what can be the possible causes? High near eye, short corridor progressive design, smaller frame size. Patient complaint might be frequent head movement while reading, loss of focus at the page edges. So troubleshooting steps would be recommended a wider corridor design, change to larger frame with more vertical depth, consider premium or personalized lenses. Excessive peripheral distortion, swim effect. And what could be the possible causes? High prescription, first time progressive wearers, low quality of the older design lenses, incorrect frame alignment. Patient might complain of feeling of motion or imbalance, difficulty walking on stairs, side vision distortion. What could be the troubleshooting steps? Ensure correct frame fitting, reduce the pantoscopic tilt if excessive, reassure patient about adaptation period, upgrade to digital freeform lenses. Next is headache or eye strain. What could be the possible causes? A. Incorrect prescription, poor lens centration, improper head posture, overuse during the initial days. Patient might complain of frontal or temporal headache, eye fatigue, discomfort after a short use. Troubleshooting steps: recheck refraction and lens power, verify lens markings and alignment, counsel patient on proper usage, recommend gradual wear increase. Patient might complain of dizziness or balance problems. And what could be the possible causes? Sudden change from single vision to bifocal, peripheral distortion, neurological or vestibular sensitivity. Patient might complain of feeling unsteady, nausea while walking, feeling of fear of falling. And what could be the troubleshooting steps? Advise slow head movements, encourage looking through the correct zones, extend adaptation time, or switch to the occupational or bifocal lenses if needed. And last is the poor intermediate vision, that is the computer zone. What could be the possible causes? Inappropriate progressive design, narrow intermediate corridor, improper screen height. Patient might complain for blurred computer screen, neck pain due to posture, and frequent head tilting. Troubleshooting steps might be: recommend occupational progressive lenses, adjust monitor height, consider customized lens design. And last is the frame slippage or poor fit. That is, a possible cause would be loose nose pad, incorrect temple length, heavy lenses, and patient complaint like vision constantly changing, need to push glasses up frequently. Troubleshooting steps would be: adjust the nose pad or temples, improve frame stability, and choose lighter lens material. That means if you have to adjust nose pad from here, so that if you widen the nose pad, so the frame rests closer to the eyes and improve the frame stability. Choose the lighter lens material. The lens material should be lighter. Thank you so much for watching this presentation, and if you have any doubts, you can ask us on our mobile number or email ID. Thank you so much.